In 2012, we had 3 cases of infectious syphilis in all of the Northern Territory, 3. Fast forward to 2016, 2017, there's 398 and climbing. So that's an example how contact tracing, if we don't do that well, has the potential to make our numbers just spiral. So we can't do a really good job unless we're really proactive around contact tracing. It's easy to test and treat. It's quite difficult to contact trace.
There's some cases where we do come into, our client requests us to come into simply because of language barriers, understanding English. English is a second language. So we come in and we support them in clinic, and we help them to understand, break it down in our language, and also getting them comfortable so they can, be more open to what, when doctor asks them questions.
Yeah, it has to do with the relationship and how you have that conversation, and not too pushy, and just going along with it and just having a yarn with them, where they feel comfortable, and then they will just give you the information without being pressured.
It's hard to know when you're working with the client or the patient in front of you to know what is holding them back from talking about the issues with you. You don't know which one of the many possible barriers are the ones that are affecting them, but it's really important to be aware of what they are so that you can gently sound them out and see how they respond and what they say, and just let them know that we're aware that these are issues that are there and that there are ways that we can work around them.
They may give their client their contacts to the nurses or doctors instead of to us, the health workers. Maybe again it could be from cultural reasons. Maybe one of the contacts could be a family member.
That when I don't get any information out of them, I then hand it over to the triage nurse and or the doctor, and they always end up giving the name.
Times people were reluctant to name contacts was because, potentially culturally they weren't the person that they're allowed to go with. But even though I would know those things in community, I would often feign ignorance and say, I don't know who's married to who, I don't know who's what skin and wrong way through law. So you can just give me the names and there's no judgment there. Fear,
the lack of knowledge, lack of understanding, or it's like, I've been with this fella, he's got a woman, he's got a family, they're worried about if the woman's going to find out, what's they going to do. But we always explain to them that everything you tell us, and everything's all confidential.
Give that extra information around confidentiality and around trust, that we practice confidentiality just as we do with the next client and the next client. I think that does make a difference. We
just let them know if you're being treated, and if you go back and have sex with the same person, you're going to have to just come back and get treated again. If your partner's not aware and hasn't been to be checked or been treated, you're going to constantly get the infection because the partner hasn't been treated.
It's not uncommon to just let contacts know, your name just came across on a piece of paper across the desk to me, and so I'm not sure who named you or where they were from. And being able to give examples or sound it out with the patients would give them reassurances that you were able to do it in a way where you weren't naming them.
Some don't want to say, they're too ashamed to say to give you the names of the person. So I find it more comfortable giving them the Post-it note, and they put their names on it. I don't have a look at it till they leave the room, and then I'll have a look and then try and find these people, whoever's on the list.
But then you have to break it down to them. This is important, because if we don't get it fixed, it will spread out. More people get sick from this and then become infertile no kids. And then they kind of realise, oh yeah, I have to do this, it's important.
It can be quite difficult and challenging to find people in community, especially if they don't want to be found. This is another reason why it's important to have good rapport with people in community, so they'll be honest with you and say he's in the house but he's refusing to come out, so that you can not waste a lot of time trying to find them. When you're in the community long enough, you get to know leaders in the family and people who've had leadership roles in community. The leader in the family, they would say to me, I've tried and I've discussed it with them and they're not coming in, but they have said that if you send the male driver, the male nurse or this other person to the house, that they're amenable to coming in with them. Or they may, sometimes they've even said to me, if you bring the equipment and you come to the house, they're amenable to sitting in the car and having a chat with you. But they're just not going to come to the clinic, to just make sure that you do it in a way that doesn't really let on why you're looking for them.
Those things around stigma and shame, and making sure that if you do get someone on the phone, that you ask them, are they able to have the discussion now, rather than having a discussion with them when they're in a community group or at a football game or something like that. So there are a few little steps that we go through before we say, by the way, you've got gonorrhea, can we talk about it? And then you've worked out that they're on speakerphone with their family. So there's ways around doing that. People can share phones at times, or people don't have phones at all, so you might get one phone number that's for half a dozen people, and again, it's about checking that you've got that person, that you don't breach that person's confidentiality before you have those discussions. So I use the web-based services with all of my clients if that's the option that they choose. So the one for Aboriginal clients is called Better to Know. It's aimed at anyone that gets diagnosed with a sexual infection that's notifiable, so chlamydia, gonorrhea and syphilis. And then the aim of it is that it's anonymous, so the person just needs 3 parameters. They put in the person's name, their phone number, and then they tick a box of the name of the infection. And then that contact, or those contacts, get an SMS, and the SMS will say, you may have been in contact with an infection, for example, of gonorrhea. Please present to your nearest STI clinic or GP. They also provide a link back to the web service, so they can actually have a look at what the infection is and how best to get tested and treated.
So many times in community, when a contact is brought in, they will ask how you came across their name, who told them, you know, who said. My strategy usually was to just tell them, I'm not sure, to be honest. I just got handed a piece of paper that had your name on it and told you a name of the contact, so I'm not sure which person, which community, male or female, so I can't tell you. But I would also tell them, even if I did know, I wouldn't tell you, because that's not what this is about.
It happens all the time, yeah. You'll have some people like, they'll try ask a question like, who was that person, like, and we'll just straight out tell them, oh, I can't say anything, it's all confidential, like, yeah.
I would let them know that being named is a good thing. It means that somebody overcame their shame to make sure that they were healthy and got the checkup that they needed, not to be damaged in the long term. So I would really focus on that point.
And I think it's more of like a shock thing, like they're shocked that they got that information. So we'll leave it and we'll go back the next day, and we'll explain, like I'll explain to them why we need to do this.
When they refuse treatment, it's very difficult to take, but I think it's important to respect their right to be self-determining, to provide the education to them, and to let them make the decisions for themselves based on information. So it's a fully informed decision, and even if they choose not to take treatment at that time, you know, we need to respect that.